and welcome into Your Health. You know, one of the most important things you can do in life, everybody tells you from an exercise perspective, is walk. In order to walk, you've got to have 2 feet that are in good shape. So today what I've done for each one of you is I brought in a podiatry team. Both Dr. Brian Kille, his lovely wife Lashonda, and it's so glad to have you guys with us today. And you know what? We brought in 2 because we got 2 feet. So you're going to handle the left foot, you're going to handle the right foot.
All right.
So, you know, it's interesting because sometimes when people are trying on a shoe, both of your feet are not the same size, are they?
That's true.
In many cases.
Yeah, that's actually quite true, especially when you start talking about arches falling, and especially when one arch falls and the other doesn't.
Mm-hmm.
There's a lot of that happens as we age, as tendons weaken.
Mm-hmm.
And that's actually a problem too that needs to be addressed. If you notice one of your feet falling,
It's
that's definitely something you need to look at so that it doesn't cause a significant surgical problem later on.
So just to let our viewers have an idea, you know, I've got gray hair now. It used to be dark black hair, it's gray hair. You're getting some wrinkles on your skin. How does the foot age? Obviously, from an anatomical position, it's going to, like you said, the arch might start to fall. Or what really happens as your foot ages?
Well, some of the muscles will atrophy or weaken and get smaller.
Okay.
Also, the fat pad that's on the bottom of our feet will shrink and
Okay.
there'll be less of it.
Where's the fat pads? Right behind your big toe?
The fat pad is on the sole of the foot. And then there is
Okay.
some fat that insulates the bones and the muscles as well, but most of the fat is on the bottom of the feet, and that's the part that will shrink and lessen over time.
Yeah, if you know, and specifically if you look at the ball of the foot here is the major metatarsal fat pad.
Okay.
And then there's the calcaneal fat pad sitting in the back. And those are the
And that would be where the heel's at?
where the heel's at,
Okay,
correct.
okay.
And those two are really prone to atrophy as we age, exposing the bones to more pressure when we walk. And once you expose those bones, there's other underlying nerves and other tissues that can cause trouble. And you can develop more calluses because there's more pressure on the skin from the bone. Calluses then can be a big problem as well. They can break down into ulcers if they're left alone and not carefully treated and cared for.
So basically, it looks like your foot, if you want to say, is divided into three pieces: the heel, the arch part of it, the main part, and then the toes.
Pretty much.
You could
Yeah.
say that.
Yeah, and each one of them needs to have proper care, because if something's wrong with your arch, you're not going to walk right.
That's true.
Correct. Yeah.
And is that something that can be treated?
It is.
I've heard the term over my life, fallen arches.
Sure.
You know, and I guess that's a true real term, right?
It actually is.
Yes.
And it has to do with weakening or even disease of the tendon, the main tendon that is contributes to the arch. So when there is disease or injury, or you have torn fibers of that tendon, then that can cause the arch to fall. So if the patient is healthy enough and they have good circulation, that's actually something that can be treated surgically to go in and repair the tendon, and then the arch will adjust. However, if the patient doesn't want to have surgery or they're not a surgical candidate, then there are arch supports that go into the shoes that will help to mimic the body's natural arch. And you would just place those from shoe to shoe and wear those to mimic your arches.
What are some of the telltale signs that you're having problems with the feet? Obviously, probably telltale sign number 1 is pain.
Right.
Right?
Absolutely, pain. Other telltale signs, well, if you start to lose the hair on your feet, that can actually that's a first sign indicator of vascular issues.
Oh, is that right?
It is.
When you say the hair on your feet, I've never even realized I had hair on
Oh,
my
there's
feet.
lots of hair.
Sure.
There's hair on the
Okay.
toes,
Hair on the
there's hair on the
toes.
middle part, and then, you know, as you start to go up the ankle into your legs. So, yeah.
Right, and when you get vascular disease and those
Yes.
small capillaries that feed the hair follicles start to get clogged, the hair dies and falls out. And so losing hair is your first sign indicator that there's vascular disease coming. So it's something to think about. And we usually, the Vascular Association recommends everyone over the age of 65 have their lower extremity vascular checked once a year.
Right.
Which is something we do in the office.
So you do that, but also if I'm going to my regular general practice doctor, do they, I know they, you know, you're there and they kind of prick your feet, or they do a couple of different things. I mean, that's what I call just a little cursory exam, as opposed to the deep down like the two of you would do.
Right. They might feel pulses or check for pulses, but pulses aren't always an indicator of vascular disease. If they did it, they would probably write an order and send you out and have somebody do an ABI or segmental pressure or something. We happen to have the equipment in the office, so we do it ourselves so that we don't have to send you out anywhere. And I've got all the records together and can watch from year to year and get you the help you need should I find that issue starting to progress.
So we're going to be looking at not only just checking the pulses, but looking at the hair, like we were just discussing,
right.
and checking the capillary fill time, which is evident on the toes. We'll look at skin changes. Does the patient have excessively dry skin, nail changes, dry and brittle nails? Those can also be signs of poor circulation.
Wow. So that's what would happen with a regular foot exam. Now, at what age should people be coming in, do you think, to have a good foot exam? I mean, when I say comprehensive, I'll use that term.
Well, that's a hard question to
It
answer.
depends on the individual.
It does,
Yes.
and insurance companies, there's not really a caveat for just a yearly foot exam,
Yeah.
unless you're diabetic.
Right.
Then that changes the rules, and you can get one every year. But non-diabetics, symptoms usually dictate when somebody would come in.
Right. In other words, like you said, pain.
Right.
Pain is one
Correct.
of the main things.
Yeah, pain or cramps, tingling, burning, stuff like that.
It's interesting.
Yeah.
Yeah. Well, I want to let our viewers know that basically, even though you're called Greenville Foot Care LLC, that you are basically, I just saw the LLC, I saw the LLC over your shoulder. I cheated. That basically you do have a practice and an office in Greenville, but you do have one in Montgomery also. So you don't have to, if somebody's watching the show, you don't have to run down to Greenville. in order to
Absolutely.
be okay. And you do not have to be referred to come into your business.
Correct.
Okay, so you can just come in, you just say, hey, you know, my feet have been bothering me, and you know, the old thing, if you've heard the word, my feet are killing me, well, then they may be killing you without you knowing, so it's great to do it that way.
Absolutely. Just all you got to do is give us a call. You can go to the website, greenvillefootcare.com. We have an area in the back where you can submit a request for an appointment, and we'll call you back
Great.
to set you up with something.
Okay, I'm going to get you to come back next week because I want to talk to people about proper care of your feet, to the fact of socks you're wearing, perhaps shoes you're wearing or shouldn't be wearing, and what they can do for your feet, if that's okay.
That's awesome.
Okay,
be fine.
all right. Just remember, to get started on a good, healthy life, you need those feet, so you might as well get them checked so that you're ready to roll. And we'll be right back right after this.